So I want to just address some general ways to address knee pain by removing basically any tug of war along the joint itself. So even if somebody's pain's up front, a lot of times some of the tension from behind can be impacting it, especially in the calf. You can, I often like to use the client's gravity. Is that tender, Jeffer?
No.
No. It's tight underneath, so I'm using my fingers, supported thumb on middle finger on middle finger. I'm just basically creating some length. I'll show you. So through here. And what I'm going to do is I'm going to lengthen that tissue while pressing by bringing my chest forward and then releasing. And slowly gliding down. And just following that tension down. Oh, tender?
Yeah.
Yeah. And in treatment, I'd go a lot slower. But I'm just going to kind of give you some different planes and ideas to work with as far as the knee goes. So from underneath the calf, that's one of the planes you're going to want to work. Also, just something to kind of keep in mind, what may also be playing a part is this: as I put his leg down, I notice how much his leg rotates out. So part of, that probably will affect his gait. He's probably leading a little bit more with the internal leg forward. He walks, which means more, when his foot comes down, more pressure through here. So if you're looking like long term to look at where the gait is and how that might affect things, is tightness through the hips often will externally rotate. And then you wouldn't normally think that up here could be affecting the knee, but if there's an external rotation and you're stepping forward, instead of if you can take a look, and I'll show you with my own leg. Tight, yeah. So instead of like forward and then the movement coming through my joint, right? If it's rotated out, when he steps forward, the inertia of his gait is coming more right through where his pain point is. So even we can address through here, which I will continue to show with this video, but where some of the culprit may be here. This over tightness that's creating the rotation, and if you can get that to release, and his walk is more forward, and the movement should be coming through with through the bendable joint, instead of, because through here it's not bendable this way, and it may be just sending over time little too much pressure, and it's when people start to, move from late 30s and onward, these things that used to bounce back when you had a lot of elastin and collagen, in your 20s and early 30s, just don't bounce back the same. And if you can change some of the patterns so the forces aren't coming through, it can either prevent further injury or rewind the symptoms. So yeah, with today we'll play with.
It's pretty tight in there too. That kind of outside line.
Mm-hmm. Yeah, it is.
And it's tight for you.
Mm-hmm.
Yeah, so that's something you could work more thoroughly. Also, really, if I was in treatment mode, I would work through here and up through here, and really see if we could get more of that rotation.
What are the kind of things you would do there?
gliding. I would probably also do some stretching for the piriformis. Yeah, I mean, it's more of it's impacting his knee, but that's more of the detail of what I would probably do. But it's a little bit more complicated than for tonight. Maybe if you decide to come back another time, we can use that as a kind of a case study of how to work that area. It'd be really good.
It's not uncommon, it's
Yeah,
quite common.
It's very common.
Mm-hmm.
Yeah, but I would rather take an entire night to address that because we've already,
Yeah,
Okay.
maybe that would be good.
Yeah.
Or I would like that, because I have clients like this.
Okay. So what I'm going to do, just to keep him from rotating out, I'm going to have my body here. Tonight we'll just do some. So what's happening is I'm palpating a bit here, and then also it's supporting both the glide of my elbow, but my elbow is also supporting my treating thumb. So it's a combination of both. This is creating a little bit of stability. So basically working some of the quadricep muscles. And sometimes some of the things I'll ask people to do, I'll do it with the next. And I know I'd want to follow it all the way up into his hip if we were in full treatment mode. It's something I also sometimes will do. So Jeffrey, what I want you to do is I want you to kind of tighten your kneecap. So use your quad muscles to, flex the kneecap up towards your, and then release. So engage, disengage. Sometimes if I'm working on where the client has a pillow underneath their leg, I'll tell them to make their leg extra straight. Because some people have a difficult time, flexing their kneecap.
This could be a time where you put the knee over your leg?
I think it would probably, let me try. I think it might not be as good for my body mechanics as I need. Probably could do, let me see. Yeah, that's an option. Like that.
Do you ever do it with the other leg, using the other arm?
I don't know if, actually that's good. Just the one thing I just needed to, I'm on my toes. So I'm not, because if I come all the way down, I'm a little scrunched in my own spine. You're right.
Yeah.
Right?
It's great though, I can tell that obviously that's
Is it at your
over something.
Yeah, it's overworking. He's not fighting me actually. It's just he's got he's got a little jump, but I actually learned the word. I'm gonna have to. It's a therapeutic jump. What did it? I learned it at
not where it's too much and resisting.
It's part of the release pattern. It's not like fibrillations. It's something, but it's a word similar to that. I learned it I went to Cynthia Wright for the first time.
Oh.
And she's like, blah, And she did that. I said, what word did you use? But I forgot it.
She's a chiropractor?
Yeah.
Yeah.
Well, we have chiropractic now.
Yeah, no, she's the
Forget about that.
Is this okay?
Oh.
I don't know. Cynthia
I
Wright,
left
yeah,
my
she's
keys in the
awesome.
car. Right?
No, she's
No,
good.
I know
Well,
she's good. She's
well,
the one I want to go to.
Well,
next.
if anything, this free promotion and
Yeah.
free advertising.
No, I've
I
heard
don't
good
think
things.
so. Yeah, she's good. Yeah, I know that if you've got one of the motor plans, she actually accepts.
Whoa. Is that too much?
No, it's like getting over a hump.
Mm-hmm. See, the thing is, the little jumping, it's local with him, right? Because if you look at just that, you're like, oh my God, he's fighting you. It's not.
Mm-hmm.
It's some of the specific muscle, because I look at the rest of him, his face isn't, his eyes have a little gentle flutter, but he's not wincing. I don't feel him with his spine. What's happening over there? Maybe
Oh, just that last one was like, whoa, is that because this whole... but I can't feel that, I only see it.
Mm-hmm. Yeah.
Yeah, I mean, if it's something that you can breathe with, then
Mm-hmm.
it's not too much. This is such a tender area.
Mm-hmm.
I think, can I talk?
Yeah, good.
I think the cool thing is that I could feel the connection to the knee the whole time.
Yeah.
The inner knee? Or just
No, like
in
coming
general?
down in under the kneecap or something.
Mm-hmm. Yeah, because we're getting not only, yeah, it's getting the muscles, right, that cross the joint, but it's also getting the fascia that wraps underneath. There you go. Little speed bump in here. Straighten your leg just a little bit, Jeffer. Yeah, and let go. Actually, comments like that enrich the video. Like to hear how it is for the person receiving. There you go. Yeah, you could do a lot of through here work that will help reduce some of the tug of war. And then, adductor works really good. But even tonight, I think if we do the back of the calf, the quads and the tightness through there, and then also I think what's really important is where the hamstrings come on the medial side of the leg, cross, and then connect in here. There's a lot of tension patterns that can be found in there that can give relief if you unwind them. And so one of the things I might do is like play with bending, little bits of bend and unbend. So I'm using my finger tip with the other one on top. Maybe, do you want to maybe come down so that it can see a little bit? Like a little close up. Maybe almost under, yeah. How's that?
Mm-hmm.
Just exploring like, oh, how do I lengthen and shorten where some of the insertions are? And then I can almost do little rotations, right? Because there is rotation, it's mainly flex and extend, but there is little bits of mobility from side to side. That can be good to explore. Tender in here.
Just like the neck work.
But it can go from, you think it's just this and this, but then there's these side. There you go. Jeffer, gently press the ball of your foot into my chest and let go. Good. Yeah, I mean it's great that I'm giving him some relief through here, but all the work through here would be great. So yeah, so if you want another day that we need a model, Jeff, if you want to come in, then we can work that stuff. It's really, we could have a whole class just on those patterns. It'd be really good to learn. You'd love receiving it too.
Mm-hmm.
I think this will probably have an effect too.
Yeah, what we're doing tonight, yeah. But so I'm gonna end the video for now, but we can, okay.